Good evening once again. Tonight, there are renewed calls for a federal investigation into New York State's response to the COVID-19 pandemic at nursing homes. This comes after New York's Attorney General released a damning new report blasting the health department for its efforts protecting the most vulnerable. The report claims the state may have undercounted COVID-19 deaths among nursing home residents by thousands. It also says a lack of compliance with safety protocols and insufficient COVID-19 testing put residents at further risk. I-Team Chief Investigator Charlie Specht takes a look at the report tonight.
A scathing report released by State Attorney General Letitia James finds serious fault with the way nursing homes in New York State handled the onslaught of the COVID-19 pandemic. The AG's office began receiving reports of patient neglect in nursing homes since the virus broke out, and in a 3-month period, nearly 800 New Yorkers flooded the phone lines with complaints. The biggest takeaway from the AG's investigation relates to the number of nursing home-related COVID-19 deaths, which the State Health Department has previously said numbers roughly 8,000. But the AG's investigators did their own counting for a sample of 62 nursing homes, and there was a discrepancy between what was reported to the AG and what the health department told the public. That report states that COVID-19 deaths associated with nursing homes in New York State appear to be undercounted by DOH by approximately 50%. But in a statement released by Health Commissioner Howard Zucker late Thursday, Zucker took issue with the AG's characterization and said there was no undercount. The word undercount implies there are more total fatalities than have been reported. This is factually wrong, Zucker said. As for the nursing homes, the AG says infections spread so rapidly because managers failed to properly isolate residents who tested positive, adequately screen or test employees for COVID, and obtain, fit, and train caregivers with PPE. Some nursing homes, according to the report, even forced employees who had the virus to work or face retaliation or termination. As for recommendations, the AG calls on the health department to stop the double counting of the death toll in nursing homes. She also calls on the state to throw out controversial immunity provisions that she says, quote, provide financial incentives to for-profit nursing home operators to put residents at risk of harm by refraining from investing public funds to obtain sufficient staffing to meet residents' care needs.
And Charlie joins us now. Charlie, what is the next step in this investigation?
Actually, the investigation remains active with as many as 20 nursing homes still under investigation by the Attorney General's office. The AG did not identify those nursing homes, so we do not know how many of them are in Western New York, but keep in mind, more than 615 people died this year after getting COVID-19 in nursing homes. That is the second highest total in all of New York State, actually.
Sure is jarring. Thank you, Charlie, for your reporting tonight.